about a hands-on approach to physical therapy. Michael Benson and Jorge Guerrero are physical therapists with Catalyst Physical Therapy. Welcome, Mike and Jorge.
Hi, thank
Good.
you.
I'm excited to bring this sort of approach to the people of San Antonio because it's different than traditional physical therapy. Mike, yes?
Yes, it is.
Tell us a little bit about it.
Hey, well, Catalyst was opened up to bring an advanced hands-on approach to San Antonio. You know, there's not too many of us in San Antonio that do this kind of therapy, you know, and the result of our training, the advanced skills, we're able to get our patients better, faster, with, you know, fewer visits.
Right. And so give us an idea of how this differs from the traditional physical therapy, the physicalness of it, Jorge.
Actually, when someone comes into our clinic, what they're going to get is they're going to get an evaluation by either Mike or myself, and we're physical therapists with the advanced training. The whole session is one-on-one. After that, we design a course of treatment for them, and the course of treatment is always guided by us.
So you guys are calling it like a hands-on, sort of a holistic approach.
It's hands-on, and the reason it's hands-on is because we assess the nerve and the joints and the muscles, and we actually feel for what's causing the source of pain, what's bringing it out.
And I understand there are just a select few physical therapists in the city who do this kind of approach, yes?
Yes,
Exactly.
that is correct.
Yes. Now, you've guys gotten some good response from people. What are sort of the feedback you're getting from customers, or clients, I should say?
Well, we've had, you know, one person that was in pain for 3 years, and after 2 visits, she was, you know, essentially pain-free. She's resumed normal activities, and she's walking around, and she was considering a surgery, and she's no longer considering that.
Now, that has to make you guys pretty excited
yes.
when you understand that it...
That's the best. That's the
that it
best
is
part of it all.
Yes,
Yes,
definitely.
and you also received an email from a lady who says that Catalyst did for me in 4 weeks what other physical therapists couldn't do in 6 months. They were able to correctly find the source of my problems in one visit. How likely is it that you will find the source of a problem in just one visit?
It's highly likely.
Yeah?
Definitely. Because that's where our advanced training comes in, because we can find, you know, we're trained to find what's causing the pain. Because even though you have pain in one body part, that doesn't mean that body part's the part that's injured. It can be coming from somewhere else.
So let's say you have pain on a level of, say, 1 to 10, 10 being the greatest. A person should come in and see you guys at about a what? On a scale of 1 to 10?
Probably about a 4.
About a 4. That's not too soon, huh?
No, not at all. You know, because the faster you get in, the faster you're going to get better.
Okay.
You know, because if something lingers for a long time, then, you know, it's going to delay the healing response, and other adaptive changes will occur in the body.
And then can become problematic long term.
It becomes problematic because people start developing compensatory emotions.
Sure.
So instead of taking care of the pain, they're avoiding it.
Right.
And over a course of time, it just continues becoming more and more of a problem, and they stop doing the things they want to do.
They want to do. Well, we want to do a little demonstration. We want to call Amy in, one of our associate producers, because Amy has had some problems with her knee, and the knee is sort of something that you guys sort of do concentration on when you come in. So will you explain to us what you're going to do for Amy?
Definitely. Pretty much what Michael's going to do here is he's going to check the mobility of the kneecap.
Okay.
And we need to make sure it's moving properly up, down, and to the sides.
So this is kind of what a client should expect coming in for an initial visit.
Yes, this would be the assessment. This would actually occur after we make sure that there is no meniscal or ligament damage.
Okay.
So this is actually the assessment of the leg. There, Mike's bending the leg, and now he's making sure it extends completely. But there's things that span the whole leg, so he makes sure that the ankle is moving properly, the joint, and there's good flexibility behind the calf.
Now, Mike, with you having touched her, what, 10, 15 seconds, what are you able to assess this for? What do you feel? Does everything feel like it's in working motion?
Well, what I'm feeling for is the kneecap moving too much or not enough? Same thing with her knee. You know, is something being blocked here when we bend her knee, or is it moving normal? And it just takes, you know, years of practice to determine what's normal, what's not. You know, so when we internally and externally rotate her hip, you know, it's limited right there in her hip. So she has limited hip internal rotation. Which it could be a joint problem, it could be muscular problem, or a combination.
There's many things that span the course of the leg, being muscle, nerve, and the joint. You always want to clear the joint above and below, because sometimes pain can be referred. So although her pain is here, her pain may actually be occurring because she has weakness occurring in the hip.
So it's always a good idea to sort of come in and get an assessment. What a lot of people tend to do is pop an ibuprofen or something to sort of mask or dull the pain, but once the medication wears out, the pain's coming back.
Yeah, we like to say you have 3 things. You have medicine, you have surgery, or you have us. And medicine is going to give you side effects. surgery is, of course, that it takes
invasive.
It's invasive, and then you still have to go through rehab anyway. So why not try conservative treatment, and let's see if we can get you pain-free.
Okay, good. So no reason for Amy to go home sick today. We're not at that stage, right? Not yet, not today.
Yet.
Now, you guys have a special offer for KENS TV for Great Day SA viewers?
Yep.
Yes.
And what is it?
So for the first 50 callers that mention KENS 5 or Great Day SA, we'll give them a free 15-minute assessment and make recommendations regarding whether they need to have therapy,
Okay.
or we can just give them an exercise.
Wonderful. Catalyst Physical Therapy is located at 2210 Northwest Military Highway. They are located in Suite B. Their phone number, 210-308-5558. Maybe they can help you. Give them a call. Thank you so much, Mike.
Thank you.
Jorge.
Thank you, Bridget.
Amy, you feel all right?
Okay.
Gonna be at work for the rest of the day, right? Okay, Amy, we don't want any funny stuff. All right, stay with us, everybody. We'll be right back with what you have to look forward to this week on Great Day SA. Eileen has your rundown coming up.